So, I'm going to be showing you some diagrams and giving you some numbers, but I want you to remember that numbers are just averages, and that, there are people who do better than the numbers, and there are people who don't do as well. So you have to keep that in mind when we go over that. I also want to encourage you to ask questions, because then I can understand your understanding of what's happening, and I can focus my discussions with you on those questions. So please feel free to interrupt at any point.
You said that it's just an average, what the information that you give us, the statistics. Since she had a recurrence and that was only like, I think you said 20% for the last time, does that mean that she's going to be in the more negative end of what these percentages are now?
That's a very good question. I'm glad you asked. The statistics I'm going to show you are for patients who have had a relapse. So it's not going to depend on whether she had it or not before. This is the subset of people who've had a relapse.
Oh, that's helpful.
So, and the numbers are going to be based on a person who's had surgery, and then we'll split off into two groups looking at the two different treatment options that we have after the surgery. Let's talk about the third treatment option, which is the surgery plus radiation therapy. Again, if we have 100 people, this time 70% of them will be cured with the surgery plus radiation therapy. Okay, so that's better than surgery alone, which is only 40%, and better than chemotherapy plus surgery, which is 60%. I'm going to recommend that you strongly consider radiation therapy after the surgery for several reasons. One, I think you've got a better chance of fighting this tumor. Mm-hmm. And two, it's a shorter duration of treatment. It's only 6 weeks.
Really?
Yeah, so you'll be back to school and back to functioning normally after 6 to 8 weeks. The whole treatment lasts about 6 weeks. You'll come every day to the house to make sure that we're understanding the same information. What is your understanding of what we've talked about in terms of the prognosis?
That, if I do the radiation therapy as well as the surgery, I have the best chance of pulling through this and not having a relapse.
That's great.
And that, I really am interested in that because it's such a short period of time that the radiation would last. So I think I'm leaning towards what you're saying, is that I would go with that option out of the 3, surgery alone or surgery plus chemo, surgery and radiation.
Okay, and Mom, what about you?
Yeah, that's still 30% that it's not successful with. Isn't there something else that makes it a higher success rate?
Again, these are numbers, and Emily, you may be in that 70% group pretty strongly. I think that you're heading in that direction, but I think it's a good question. If in the unlikely situation that this recurs, there are other treatment options that we can use in the future. Again, I'm very optimistic.